The information shared on CNS Unfiltered is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your healthcare provider before making any health or lifestyle changes. The views shared are those of guests and do not necessarily reflect those of Innate Clinical Nutrition or its affiliates. This episode includes affiliate links, which help support the show. Hello and welcome. I am Jena Salisbury, and this is CNS Unfiltered, a show where clinical nutrition specialists uncover what traditional medicine overlooks. How do you like to get your movement into your day? Do you like nature walks? Do you take breaks to dance during your workday? Do you play a sport? Maybe you crave more extreme ways of movement like CrossFit or powerlifting or ultramarathons. No matter. We should all be incorporating movement of some kind every day. Movement brings us joy within our bodies and in our minds. It keeps us healthy and sane. It helps us solve problems, reduce stress in our daily life, and prevents your risk of serious physical, mental, and emotional conditions. Movement is a way to keep your mind, body, and spirit healthy. If you're moving during the day, especially if you're doing those extreme activities like CrossFit or training for a marathon, it's so incredibly important to take in, believe it or not, I'm going to say carbohydrates. Carbs are what give your body the endurance and fuel we need in order to perform our best because they are the most direct links to sugar and glucose that the body uses for energy. If you're moving and expending energy, you need glucose. If your body has glucose, your body has more energy. If your body has energy, then it's harder to get fatigued during your workouts. But not all carbs are the same. If you're a runner, it's easy to turn to gels or peanut butter or honey or even other processed sugars like a Pop-Tart in order to keep those glucose levels up and your energy high. And yeah, maybe it's keeping you energized. Maybe it's allowing you to hit a PR or get ready for a marathon. But maybe those carbs are also triggering inflammation, gut dysbiosis, or other debilitating issues that are actually deeply hindering your performance. What if switching that Pop Tart for something more complex, like a sweet potato, could get you back in the game and allow you to totally push the boundaries of what your body can do? If you're an athlete who's ever suffered from a serious health issue, you know how traumatic it can feel when you suddenly can't perform like you used to. If you don't know the source of the health issue, it can feel doubly traumatic, like your body's betraying you. Today's episode is another example of how the source can almost always be rooted in what you're eating. Today, I talk with Lindsay, owner of Alpine Fuel Nutrition in Denver, Colorado. As usual, she'll walk us through her journey to become a CNS, and then we'll discuss how Lindsay helped a client get back to running 10 miles a day, all by looking inward at her gut. Welcome to CNS Unfiltered. I am so excited for today, and today we have Lindsay. So Lindsay is coming to us from Alpine Fuel Nutrition. She is also the clinical content developer at Institutional Functional Medicine. So it's a real treat to have her here with us today. On top of her amazing background, she is also a wonderful case study within herself, overcoming Lyme's and other several health conditions that have led her to complete physical accomplishments that only a small piece of our population can even say they do. So what an amazing story. And we're so lucky to have you here to share your experience as a CNS, what brought you here, and then to touch on a case So I'm going to turn it over to you. If you can get us started, I'd love to hear a little bit more about you, your journey, your experiences, and the kind of like the words of wisdom on that journey for future CNSs.
For sure. I'm so excited to be here, like genuinely really excited. So thank you for
Yay.
having me. My name's Lindsay Christensen, and obviously I am a CNS. I always knew I wanted to go into healthcare. So, as I was trying to figure out a major, kind of at the end of high school and college, I started off on a physical therapy track. But like you alluded to a second ago, my own health journey kind of directed me in along a different path ultimately into the nutrition space and specifically the functional medicine and functional nutrition spaces. So I, during college, became really, really sick. A lot of bizarre symptoms, a lot of neurological symptoms, chronic fatigue, and gastrointestinal problems. And ultimately, after a number of years of struggling, I was diagnosed with Lyme disease, along with a few other, co-occurring health concerns like SIBO. And yeah, the conventional, I saw a dietitian, I saw, plenty of doctors. And, while there's a time and a place for accessing that sort of care, of course, it wasn't, unfortunately, or maybe fortunately, because it pushed me down a different path. I wasn't able to get the help I needed to heal my own body, through those more conventional routes. And that is what led me to the world of functional medicine and functional nutrition. And I actually, this would be like 13 years ago now, I met with a CNS in my Lyme disease doctor's office. And she gave me more information about the CNS path. And I ultimately decided to pursue that. So I have my Bachelor of Science in Biomedical Science, and then I went on to get my Master of Science in Human Nutrition and, do my 1,000 hours and sit for the exam and pass the exam and everything to become a CNS. So, over the years, I'll be honest, I've thought, oh, should I have gone down a different healthcare path? And then when I really think about it, it always comes back to nutrition for me. I really love what we do as CNSs, and I'm so passionate about spreading the message of what we do, and then, of course, helping clients.
As you know, CNS is so broad right now, and it's very fight for it. I don't know how else to say it, but as a CNS is not, we are different than an RD, and it's not quite recognized yet. So finding that niche of where a CNS can get in, where they fit in, is a huge piece after you graduate. So I think it would be wonderful to hear that progression for you, if you don't mind sharing.
Absolutely. I've done a lot, and I'll share some thoughts on kind of how we can position ourselves well as CNSs too. Just a few quick thoughts based on what I've experienced. But actually, my entry point, work-wise, professionally into the functional nutrition space was actually working as a research assistant and writer for Chris Kresser for his
Cool.
for his website. So that started in 2016, and I was actually, fun fact, I was going through Lyme disease treatment at the time, going through my antibiotic treatment that was making me so sick. But when I got that email that they wanted to interview me after I submitted my application, I pulled myself together, sat for that interview. I think there were a couple interviews after that, and ultimately got that position. And I will forever be grateful for that experience because it was the entry point for me, and I learned so much. Writing hundreds of articles, both under his byline, and then ultimately I ended up contributing some under my own byline as well over the years. And I worked for him for about 4 to 5 years doing that. And then at the same time, I collected experience in other places. Something I think can be valuable to CNSs is, using like an ancillary skill you have in addition to your nutrition skills, and like really capitalizing on that to really position yourself as a unique either somebody to hire or a unique practitioner in the space. So for me, writing, I think was that skill. So I picked up some additional writing jobs over the years in the functional medicine space, including for a supplement company called Quicksilver Scientific. And I really enjoyed that. And then I did some writing for Well Theory, which is an autoimmune based functional nutrition program and some freelance writing for other providers as well. So that was a great experience. I mean, you learned so much to really help build up your skill set as a provider, when you are researching and writing a lot. And then from there, when I was working for Chris Kresser as a writer, I got the opportunity to work as a nutritionist in his functional medicine practice. So, the California Center for Functional Medicine, which is still up and running. I no longer work there, but they're doing well. I worked there for a number of years, and then seeing hundreds of patients there in that. So that's where I got the bulk of my experience. And then also, Chris Kresser had a separate telemedicine practice during like the peak of the COVID years. Actually, it was like 2020 to 2021, and I saw more patients there as well. So there was kind of not a formal mentorship piece, but just so much observation and learning there. And then, of course, a ton of experience, helping patients nutritionally. So that was great. I also had my a nutrition practice, a private practice where I worked with clients with Lyme disease for a couple of years. I did end up in 2023 closing that down. I will be honest, I was very burnt out. Like I was sick. I was sick from the stress of, clients with Lyme disease need help. They need our help. But as a solo provider, trying to help clients not in a clinic setting, it was too much for me to handle. So I did end up closing down that practice in 2023. And I really firmly believe that, patients with Lyme disease still need to work with the CNS, but ideally do so like in the practice, where your Lyme doctor is. So that care can be coordinated. So when I shut down that practice, I then opened a new one. This is really like following my heart and also wanting to connect more with my local community. And I live in the mountains of Colorado. So my local community, the active athletic people up here. So I opened Alpine Fuel Nutrition also in 2023. And now I see mostly local clients here. So everybody from like trail runners to rock climbers. So really that active demographic, but coming at that nutrition care from a functional nutrition perspective, which I think is unique out here. There are a ton of sports RDs out here, and some are leaning more into the functional space. But I think that's really what makes me unique is all of this cumulative functional nutrition background that I think not a lot of people have, not a lot of nutrition providers have out here. So sorry, that was a lot. Hopefully that was helpful.
It was beautiful. And it really does capsulate the depth of the CNS knowledge. Like I can speak for my side also, just saying I got hired into a functional office. I originally went to RD and then I got hired into a functional office right after. And it was training, right? It was the development, project development. It was the research. It was the writing. It was implementing and taking that. And it really took about 7-8 years before you feel like, okay, I think I understand. I think I understand the doctor side of it, the hormone side of it, because most offices, if we're going into an office, most, not all, functional offices, they're going to have hormone and thyroid pieces in that too. Um, and so really collecting all of that information to be like, okay, I understand traditional medicine, I understand functional medicine, and then I understand the nutrition gap that is needed to bring all of this over. And that does not happen overnight. That does not happen with a 2-year degree. That does not happen with 1,000 hours, right? Like that is something that you continue to build. And I think your story really capsulates that that there are many, many options and how knowledgeable we are because of all the different places we have to learn and we have to be in for our skill set. So thank you so much for sharing all of that.
Yeah. I think the fact that we have to be as CNSs. Maybe I don't like to compare us to RDs all the time, but I feel like we have to be a bit more creative sometimes in like how we're pursuing positions. And while that can be, and there's been times, I mean, stretches for months, years where I've been very frustrated trying to
Mhm.
find that right balance of work and trying to find a position where I really felt like it was a good fit and I could serve people the best. But I think there's a plus to that kind of forced like creativity because it can help us find these positions that um, really are a great fit where we can serve people to our fullest potential and also do other things, whether it's writing, recipe development. I mean, just all sorts of things that there are all sorts of things we can do.
It's so true. Thank you so much for sharing your journey. I do know that you've prepared a case study, and I'm super excited to hear it.
Yeah, I'm happy to share a case study. So, I briefly mentioned I live in Colorado, mountains, work with active clients around here. Mostly my clients are local, but I have a few in California, as well. So a lot of my clients are brand new to functional nutrition. They haven't heard of it before, functional medicine. I'm not practicing medicine, but functional medicine is not something that they have heard of either. So it's just like a new world for them. And while my clients are usually pretty active and outdoorsy, that does not mean they don't have health concerns. So usually they're coming to me, with like a performance or recovery concern. I do tend to attract, as you'll see with this case study, a number of clients with gut issues. So, gastrointestinal health is one of my, I would call it a specialty. Um, but yes, most of them are kind of brand new. So it's fun to introduce them to the world of functional nutrition. It can be tricky as well, but it's ultimately fun. So this case study client is a 38-year-old female. I saw her about like a year and a half ago is when we began working together. And she's an oncologist and a trail runner and also a mother and wife. So a busy lady. And she was referred to me because she'd been dealing with chronic loose stools and bowel urgency for about 18 months, both in her daily life and then definitely while running. And it was really disrupting both aspects of her life, just her daily going about her daily life and then also her running. So she had previously met with a dietitian who did suggest the low FODMAP diet, and she tried the low FODMAP diet for about 2 weeks before deciding that it wasn't a fit for her with her busy life. She just felt like she didn't want to do it, and she couldn't do it. And that was kind of the main nutritional suggestion that had been offered to her with that previous dietitian consult. She also, and I always make sure my clients have done this when they come with gut issues. She'd already done a full GI workup with her
Cool.
gastroenterologist, including a colonoscopy. So, the colonoscopy was negative, and she was ultimately diagnosed with IBS-D. So, diarrhea, predominant IBS. Interestingly, her GI doctor, and let me know if I'm going into too much detail now at any point and I can go higher
Nah,
level.
let's
But
nope,
okay.
unfiltered. So whatever you think is important right now,
Okay.
and this is bringing it all together. So go for it.
Yeah. Okay, cool. So actually her GI doctor, interestingly enough, had prescribed rifaximin for her for a couple of weeks, which we'll circle back around to that. And she saw some short-term improvement, and she'd also tried psyllium and cholestyramine. The latter one is like a bile acid binder, right? So she didn't see any benefit with the psyllium or cholestyramine. And she had a few food sensitivities, mostly the veggies we would call like the insoluble fiber veggies, so like your broccoli, cauliflower, bell peppers, those sorts of things, spicy foods. And she also was kind of self-diagnosed lactose intolerant. So some clear food sensitivities. And then she had tried removing gluten and dairy in the past, but didn't really see any improvement. I asked her for how long, and it was like a couple of weeks. So we could argue whether that was long enough, but she hadn't seen much. With active clients with gut issues, I screen for a few different things besides, or in addition to that, asking for that GI workup. She screened negative for disordered eating behaviors, which sometimes can cause gut issues. So that just, it was, clear to me that I didn't think that was a concern. And I also screened for low energy availability. So just insufficient food intake to meet exercise demands, because that can cause gut issues as well in active people. And that screening was negative as well. Um, so with those symptoms, in addition to a history of food poisoning, and she also dealt with rosacea, I started to suspect that SIBO might be an issue. So here's where the functional nutrition brain comes in. So I asked her to talk with her GI doctor about running a SIBO test because she already had the doctor there, could get that covered by insurance for her. So she did that SIBO test and it came back a strong positive for hydrogen dominant SIBO. She had some nutritional markers that were off as well, that suggested low B12, suboptimal iron, and there could be many reasons for that. But I did screen her dietary intake, looked sufficient for these nutrients, leading me to think it was, more of an absorptive issue, which can happen with SIBO. So she ended up kind of high level. She did antibiotic treatment under her doctor's guidance. And then I also supported her with nutrition and supplement protocol for the SIBO as well.
I do have a question.
Yeah, of course. Uh-huh.
When you did the screening for the nutrient pieces like the iron and the B12, is that something you had the physician take care of and have it covered by insurance? Or is that something that you sent out and did more through like an oats test? How exactly did you collect that data for the nutrients?
So her doctor actually was open to running those labs. So the only one the doctor wouldn't run was that methylmalonic acid, MMA, to assess functional B12 status. But we got like the full full otherwise full blood work. So like she had kind of functionally high MCV and MCH with a B12 of 428. So not ideal. So, I felt that was enough information. And usually with my clients, because they are new to functional nutrition and the cost of labs can be shocking because they haven't operated outside of their insurance-based system, I am happy to have them go to their doctor first with the list of labs. And then from there, we can figure out if they won't order certain labs, how we can kind of fill the gaps and get that complete picture.
Awesome. Awesome. Thank you.
Yeah. So yeah, I did that supplement and nutrition protocol to support her after she did the round of antibiotic treatment. And, the way I explain that is that clients can see improvement and do see improvement, with something like rifaximin, but oftentimes we can see more sustainable, positive outcomes when we're supporting, supplement and nutrition wise. So more specific to an active client with a gut issue like this, it's nice when there are some low-hanging fruit. Like she had a very, very high flour-based, more processed carb intake, just being, really active trail runner, running like 10 hours a week. So we had to find that balance between getting her, the right carbs, to both type and quantity to support her training while trying to reduce intake of the ones that can fuel that bacterial overgrowth and dysbiosis in the small intestine. So we worked quite a bit on that. We also worked on like stress reduction when eating, because that can disrupt the migrating stress, that is, can disrupt the migrating motor complex and make people more prone to kind of that disrupted gut motility and possibly SIBO. We also worked a lot on orienting her more towards whole food eating while navigating the food sensitivities she already had. So I did not recommend low FODMAP again. It was clear that was not going to work for her. I did just ask her to do a little bit of food journaling just to cultivate a little bit more awareness around whether there were any other foods bothering her, not so that she could eliminate them entirely, but just so she could get to know her body better and better understand also in relation to her running. Like maybe she doesn't want to eat a really fibrous meal an hour or two before her 2-hour training runs. So it was fun for me and helpful for her to combine the gut work with kind of a therapeutic food plan for gut health with a sports nutrition oriented plan.
Beautiful. And
Yeah.
like this is the epitome of personalized nutrition, right? When you go to the doctor to an outpatient RD, it's here's your piece of paper, here's the dash diet, here's the FODMAP, here's what it is, have a good day. And it's not taking all that clinical pieces for that precision nutrition that functional medicine is known for. I'm also wondering if you don't mind sharing, is there a certain trick or tip that you use or recommend when you're asking your clients to kind of have that calm, mindful eating experience? Like, do you do any vagus nerve exercises, or is there a certain meditation, or what do you find works? Like, what is your recommendation, if you don't mind sharing?
I like to give them options because different practices will resonate
Hmm.
with different people. So for her being kind of like me, like always on the go, the way for her to relax around meals was to take a walk, before eating lunch. So like getting away from her desk and just going outside, taking a walk to kind of decompress before eating. But other options I will present to clients would be doing like box breathing, a couple rounds of that before eating. For others, it's just getting away from screens. So getting away from the computer, the phone, the tablet, whatever. I'm going to blank on the website name. But there's a website that has some good like mindful eating meditations. You could probably just Google mindful eating meditations, and some clients like to do that. So I just offer different options. I try to gauge it based on the client's personality and they can just tell me out of the list of options, what feels most doable to them.
That's perfect. And I just want to deep dive it one more layer deeper for our audience of why this is so important. And it seems so juvenile sometimes, right? Like, oh, like get away from a screen or go for a walk, or the body has operating systems, and you're either going to be in a fight or flight operating system or a relax, digest, release operating system.
Mhm.
So to do the exercises that you mentioned, they're actually to put the body into that relax, digest, release state, into that parasympathetic nervous. And just by doing that, it increases our digestion and it brings out more hydrochloric acid and more enzymes. And so you're actually able to move things through. When we have that halt and we're kind of stuck and we're preoccupied, it all that stops. And when that food sits in the upper intestines, that's when that bacteria have everything they want to eat with no acid from the stomach,
Mhm.
leading to that SIBO outcome as your client. So I just want to kind of piece that together for our audience.
Yeah, I think we forget that digestion starts in the brain. The technical term
Yes.
is like that cephalic phase of digestion. So even thinking about food, thinking about seeing, and then also our other senses before we taste it, smell, all kind of jumpstart that get those digestive juices flowing. And that's not happening when we're like holding our breath inadvertently while answering emails while eating. So, um, yeah, and it's like a domino effect with digestion. It starts in the brain. It's like if that's working, all the other a domino effect in the good way. All the other dominoes will fall as far as digestion and gut motility goes.
Exactly.
Yeah, so SIBO, we did that protocol, and this was also fun for me because she saw results in 2 weeks. I'll be honest, that's not common. I remember clearly when she messaged me, and she saw some improvement with the antibiotics, but within 2 weeks of the supplement protocol and some of the food changes, she was not experiencing those loose stools all day long anymore. She was having like 4 or 5 a day, and then also the urgency when running. So, yeah, that was like a pretty positive, nice, quick outcome. But we did talk about how there's a role of maintenance here and continuing our good eating practices, our good nutritional practices. The supplements aren't usually things we take forever, but there was, I did try to emphasize that this wasn't like a a one and done completely sort of intervention. There's that active role of maintaining gut health too, especially because our ongoing stressors day to day may not necessarily change that much. And also with runners, especially with like the volume of training she was doing, there's some stress placed on the gut as well. So again, bringing in like the sports nutrition piece, we can see more like intestinal permeability and leaky gut in endurance athletes, and then also some changes in the gut microbiome, sometimes inflammation, especially during like longer bouts of endurance activity. Blood is getting shunted away from the gastrointestinal tract to the muscles and the heart and things to fuel that movement. So that brought in another important piece that we had to cover, regarding foods she could incorporate to really support her gut long term, because she's not going to stop running. So, and nor do I want her to. So that was another piece we brought in.
Do you think there was a specific pivotal piece that got her health to change? Do you think it was the antibiotics or the supplements after or the changing of view of food? What would you say?
The supplement protocol made a big difference for her. She did reiterate that, quite frequently and briefly. I won't go into all the details of the supplements, but we used like an herbal product. We used a couple of probiotics, some digestive support aids like digestive enzymes. I have the whole protocol, so it's like certain amount of time on each thing, weaving them in gradually. But the herbal product in particular, she commented on how like once she started that, and I try to space the introductions of supplements a few days apart at least, so we could try to gauge hopefully that she's tolerating things, but also maybe some effects of individual products. And she did find the herbal products really helpful, and that's not something she'd ever tried before. And sometimes that can be a hard sell, especially for like an MD coming from the conventional space. It's like, oh, herbs sound weak, like weak sauce to her. I told her this is not weak sauce. So that's why we're only using it for a couple of weeks at a time. And yeah, that really did make a big difference for her.
Beautiful. Thank you
Yeah.
for sharing that.
Yeah. So she's still maintaining her gut health right now. And, some additional things just ongoing we have worked on together, kind of building off of that. We're supporting her B12 status and supporting her iron status. And, periodically checking in on those things, as part of, um, overall blood work. And then also with runners, again, tying in like functional nutrition, sports nutrition here. We've done a lot of work on her pre-run fueling plans and what she's consuming during her runs as well. And your typical trail runner will do like graham crackers, stroop waffles, not that there's anything wrong with doing that occasionally, but she was doing that all the time before her runs, just like they're really processed. And then also, runners will tend to consume their gels, their chews, all of these refined products during running. So we have done some work on really optimizing what she can consume pre-run, focusing a bit more on whole foods like her rolled oats with like the right amount of protein added for blood sugar stability, and then her during run fueling plan, using some more like the whole food oriented fueling options that are emerging for athletes. So
Do you think you might be able to share one or two of those for the
uh-huh.
athletes that are
Yeah.
listening right now?
Yep. So there's one brand called Spring Energy. They underwent a little bit of controversy, I think it was last year, where one of their nutrition facts labels on a product was not 100% accurate. And that's like a big deal for runners who want to get a certain amount of carbohydrate, per hour. They did work on correcting that issue. And I'm not ready to throw out that company completely, because they are one of like the best, in my opinion, whole food oriented sports nutrition product companies. So, just for example, their gel is based on basmati rice. They have fruit mixed in there. They have like real salt. They use honey. So it's like whole food ingredients as opposed to like Cliff Blocks that have dextrose, sucrose, different natural flavors, but just like additives and stabilizers and things in there. So So I like Spring Energy. There's another one that more of my like hiker, backpacker clients use called a Mirror Energy. They use ingredients like blackstrap molasses, cashew butter, coconut butter. So they have, you might not want to consume that if you're a runner, but like for somebody doing long hiking adventures, backpacking adventures, which some of my clients out here do as well. I really like that company as well. So yeah, those would be a couple.
Awesome. Thank you. And is there one myth you would like to debunk, maybe for our runners or gut patients that they come into? Maybe this is perfect because you did have an MD with all of the traditional background. What do you think was the one myth that had to be debunked to move forward from traditional to functional medicine?
Yes. So for runners, I would say there is a myth out there that your gut issues can just be fixed. Gut issues while running can be fixed by gut training, which is a practice whereby runners like try to train their gut to just consume and tolerate more and more carbs, just more and more and more until they reach some like magical number that works great for them. While there could be a time and place for that, I would argue that a lot of runners need to work on improving just overall gut health and finding more of like a whole food approach to support their bodies. Because even if we're really physically active and, outwardly very healthy, if you're having chronic gut issues, that is a sign that there's an imbalance. And we're not, active people are not impervious to gut problems and health problems that need attention. So I guess that was kind of two myths. One, the gut training piece, and the myth that, well, I run, 50 miles a week, therefore I'm perfectly healthy. I see a lot of clients who do run that amount, but they have, some like foundational health matters that really need to be addressed for them to fully like realize their athletic potential and to feel their best in daily life too.
Beautiful. Thank you for sharing that too. I'm going to pick your brain a second because athletes are not my everyday go-to, but from my understanding too, like when we're training at that level and we're getting all of that anaerobic energy through the body, especially if it's paired with high protein and high carb diets without all the antioxidants, this also leads the body to be more in an acidic state.
Hmm.
And that acidity in itself can lead to a deregulation, defunction of the gut or different organs or respiratory of how we're circulating all of our gases and what's able to grow, right? Nothing positive normally grows in an acidic environment. And that's something that I think would probably be very important for them to note, like at a cellular level of what could be
Hmm.
happening with
Hmm.
that diet paired with that training.
Hmm.
Am
Sure.
I on the right path with
Well,
that?
and here's where, yeah, and
Okay.
here's where I'm not picking on RDs at all. I'm just commenting on kind of the norm,
But
which is
mhm.
like meeting your macros. So, like, we'll just use the runner example. Like, you need to get enough carbs. Get those carbs mostly however you want. Some sports RDs, the front page of their website is them with like a Pop-Tart in hand, talking about how this is your good pre-run fuel. It's got just the amount of carbs you need. And uh, maybe occasionally, not a regular thing. I mean, I don't think that's ideal. I think we need to always have quality, like our food quality front of mind, because athletes are demanding a lot of their bodies. And again, like going back to that myth of, well, I run X amount of miles a week or I lift X amount of weight, therefore I'm like perfectly healthy. Well, compared to more sedentary person. But actually, we need to pay even more attention to our nutrition, the quality of what we're eating, as an active person, demanding a lot from our physiology, and just focusing on the amounts of carbs, the amount of protein, and ignoring things like our food diversity, the foods that are going to feed our gut bacteria, the quality, where our food is coming from. When we let those things fall by the wayside, I think we're leaving a lot on the table, because, just eating a lot of processed white carbs is like, all of us CNSs know that's going to throw us into more of an inflammatory state. And, for athletic people, demanding a lot, having some gut stress from their physical activity, that's going to potentially hinder, their performance and recovery, not to mention all sorts of other aspects of their health. So, yes.
Definitely. And I just want to comment too that I do have a background um, in RD and as a CNS. RD is very think hospital, think very, very calculated, think very like it's a lot of math, but you also only have what's available inside of that hospital setting, right? That's where RDs were first coming into use. And so we think of JPEGs and we think of the IV nutrition and we think of more of a calculated base of macronutrients to keep that person alive. And so that is very important in that setting, right? But when we come outside of that setting and we're looking at more of the precision nutrition and the details of the biochemistry and the details of that person and the details of what makes the system run, that I feel is where the CNSs really shine. And that would be the biggest difference for people who don't know. Like, I don't know, I see a nutritionist, an RD, CNS, I don't know the difference. I do think that is one of the pieces of why they're more calculated or don't think of the more detail piece of that versus the CNS saying, I don't care about the calculations. I care about the lab work, what you feel, and the underlining pieces of what this is going to give you long term.
Absolutely. And to be clear, I still run calculations. Like I still
Oh,
use
yeah, we
and
have to use the
provide targets
calculations.
and numbers. Yes. But it's like finding that balance between quantitative, qualitative, nutrition, which I think like you just said, as CNSs, we're poised to do that, quite well. So, yeah.
Perfect. Thank you so much for sharing everything that you have today. I know you were in Colorado, but do you also take on virtual patients? So if anyone listening now said, ooh, I'm an athlete, I got gut stuff, I might even have some Lyme from running in the woods, I need Lindsay. How can they find you? How could they reach out?
Yeah. So they can go to my website, which is alpinefuelnutrition.com. And yes, while I mostly work with clients in Colorado, I do see, some clients virtually telehealth. Well, all my clients are virtual, I should say. I see some clients telehealth as well. And as we know, that just like depends on the states where we CNSs can see clients. So I see a number of clients in California, and then I'm licensed in Washington, Illinois, Maryland. And then, we're always keeping tabs on how the states are changing. So reach out if you're interested and we will check and see and figure things out. And then I'm not super active on social media, but I do have an Instagram account, which is also Alpine Fuel Nutrition. So either one of those places would be a good way to reach out.
Beautiful. Thank you again, Lindsay Christensen. Sharing your passion for functional medicine with me and with our clients has just been amazing, especially for our athletes in the audience. Thanks to our listeners for tuning in today to this episode of CNS Unfiltered. Take a look at the carbs you're eating. Our diets absolutely impact our athletic performance. That's a given. But it's important to remember that even if we think we're eating well, if we're still experiencing chronic health symptoms, there might be some work that can be done to help your bodies thrive. For any listeners in Colorado, California, Washington, Illinois, or Maryland wanting to get in touch with Lindsay, check out alpinefuelnutrition.com to reach out, or give her a follow or send her a message on her Instagram at alpinefuelnutrition. And even if you're not in those states I just listed, if you're curious about how to align your body with your movement goals, a CNS just may have the answers. Once again, I'm Jena Salisbury, and remember to listen to your gut.